This is our final AAC project by Alexis, Jessica, Andrea, and Chris. Our project was done on a 4-year-old named Austin. He has autism and childhood apraxia of speech. Per parent report, all developmental milestones are delayed. He currently lives at home with his parents and his 4 siblings, and English is the primary language spoken in the home. The following concerns are listed. He is unable to communicate his wants and needs. He demonstrates inappropriate behavior associated with a communication impairment. He is unable to determine specific skills and knowledge without universal, efficient, and appropriate communication. He does not indicate greetings or social interactions with others, demonstrates difficulty with motor planning and sequencing tasks, and demonstrates an absence of verbal communication. He is extremely limited in the use of signing to communicate. Other services Austin is currently receiving include occupational therapy, ABA therapy, speech and language in the school, and speech and language privately. Preferences and skills. Austin responds negatively to physical contact. He is highly sensitive to scents, jeans, tags, and any glove textures. He does prefer the color blue, and he is ambulatory and demonstrates the ability to direct select.
A battery of informal and formal assessments were conducted with Austin to determine his current communication abilities. Informal assessments concluded that he currently has minimal pragmatic skills. He has adequate facial symmetry and no malocclusions. However, the oral motor exam revealed a poor ability to elevate the tongue tip to the nose, although he was able to do this at home with mom per parent report. His diadokinetic rates were not assessed due to the apraxia of speech. Speech intelligibility and articulation were also unable to be assessed due to the apraxia of speech and limited verbal output. Lastly, the informal assessment of visuospatial skills, as well as factual, auditory, visual, and working memory, were also deemed to be within normal limits. Formal assessments included the AAC assessment of the TASP, the expressive one-word picture vocabulary test, and the receptive one-word picture vocabulary test. Results for the TASP showed that he had greatest success with concrete objects in a 60-location layout. However, abstract language proved to be challenging for Austin. In the expressive one-word picture vocabulary test, Austin had strengths in identifying foods, environmental, animals, and word approximations for targets containing bilabial placement. In other words, sounds P, B, and M. He exhibited difficulty in utilizing one word to name pictures and difficulty with identifying objects and concepts related to farming. Overall results showed an age equivalency of less than 1 year old. The receptive one-word picture vocabulary test results showed that Austin had an age-appropriate comprehension of objects, actions, and concepts, and strengths in present progressive ing verbs and understanding of mathematical terminology and food topics. However, he had difficulty with unfamiliar shapes and noun words. Overall, results showed an age equivalency of 3 years and 8 months. 3 device trials were taken for Austin. The first was a trial on the Nova Chat 10 by Saltillo. The activity included a play with bubbles to assess increased independence, commenting, and functional language with use of this device. Austin demonstrated effective communication skills to participate in a structured play activity through use of this device. With a trained communication partner and a continuous direct physical cue, Austin was able to communicate the following: more bubbles, my turn, your turn, all done, and that's silly. Adequate memory skills were observed by Austin's increased independence with locating icons. With continued use, prompting was decreased to a direct verbal cue to assist in increasing the rate for icon location. The inclusion of a key guard assisted eye-hand coordination and increased overall accuracy of selection. Although Austin's ability to successfully locate the icons increased, he demonstrated difficulty comprehending the meaning of the messages he selected. For example, when he selected your turn, the clinician would take away the bubble wand and Austin would scream to indicate frustration. Overall, the NovaChat 10 provides Austin with the ability to independently locate and select messages. However, it was deemed that he did not demonstrate comprehension of the PCS symbol set. Based on this performance, a second trial with another system that included different symbols but a similar layout was warranted. Therefore, device trial 2 included the Tobii Dynavox T10, a turn-taking play activity for completing a Dragon Tales puzzle was used to assess his ability to handle changing pages, abstraction representation, size of field, and tolerance of screen and touch surface by using the device. Austin was presented with individual words and short phrases that pertain to a puzzle activity explicitly modeled by the clinician. Moderate levels of assist included direct cueing, in which the clinician directly pointed to the icon while verbalizing the selection, in addition to hand-under-hand physical assist. These prompts increased Austin's accuracy when making selections, including good, wrong piece, that's silly, and more please. The method necessary to navigate the device was overwhelming for Austin, and therefore he did not successfully navigate to additional vocabulary pages. Although Austin was successful in communicating messages when provided with appropriate assistance, the layout of this device hindered his ability to effectively and efficiently communicate. Therefore, a third system was trialed to identify the most viable option for Austin. Device trial 3 was conducted with the Accent 800 by PRC. Austin participated in a conversational exchange about a familiar topic, which included reading a picture about the word blue, to analyze his ability to inform, share, and comment on a specific topic with an increased screen size and a different symbol set. Core vocabulary and adjective pages were trialed on a 60-location layout during this structured reading task. Austin was able to select the program icons blue, frog, and hat following explicit instruction from the clinician when provided with direct physical cues. Frequency of cues provided decreased as the session progressed. Spontaneous message production was observed due to a high level of interest. Additionally, Austin navigated through the device and independently selected request icons such as turn the page and all done. Austin demonstrated independent communication while utilizing this device and expressed genuine interest in the use of the device upon completing the activity designed for the trial. Therefore, it is recommended that Austin receive the Accent 800 by PRC device with the 60-location display. Results of the devices also indicated that Austin needs a direct selection method with a key guard and synthesized output. The following is an expert of the evaluation of intervention trials with the Accent 800.
Look, Austin, this book is your favorite color.
Blue.
It's blue. Tell me, what color are these balloons? Let's see.
Blue.
You're so right. These balloons are blue. Okay. It's time to...
Turn the page.
Okay, I'm gonna turn the page. Oh, let's see, what do we have here? Blue can hop across the ground. What animal is this?
Frog.
Look, it's a frog. You tell me, what animal is this? It's right here.
Frog.
Good job, it's a frog. Okay. I'm going to
Turn the page.
turn the page. Okay. Look, here's another blue animal. This animal has feathers and it sings. Where's the bird?
Bird.
Look, it's a bird. You tell me, what animal is this?
Bird.
Good job, it is a bird. Okay, tell me. Should we,
Turn the page.
or are we?
All done. Turn the page.
Okay, I'll turn the page. Oh, this protects your head and face. What is this?
Hat.
It's a hat. You tell me. What is this?
Hat.
Good job, Austin. It is a hat. Okay, should we,
Turn the page.
or are we?
All done. All done.
All done. Okay, all done, book. Good job.
Based on the evaluation and Austin's current needs, the recommended goals are as follows. In the long term, the client will independently utilize a speech-generating device to communicate choices, comments, and greetings. To work on this, the client will produce a greeting and a farewell to greet and state a farewell in a natural context of conversation. He will also respond to a greeting and a farewell. The client will also produce a set of core words in 2 to 3 word utterances within a session 5 times with moderate to maximal support. The other long-term goal for Austin will be for him to program functional vocabulary sets within a speech-generating device to effectively communicate within all environments. To do this, the client will assign meaningful icons within a vocabulary set 3 times when provided moderate to maximal support. He will also program icons during conversation to repair any communication breakdowns as needed when provided with moderate support.